This week, Oregon Medical Group patients received an email detailing the planned closure of an OB-GYN service at their health clinic.
Yesterday, I spoke with Women's Care, who will be onboarding a group of former OMG providers about what patients in the area can expect. Joining us this morning on NBC 16 today from Women's Care is Dr. Catherine York with an exciting new announcement about some expanded care coming to Women's Care. First of all, Dr. York, how are you this morning?
I'm great. Thank you, Zach. Pleasure to be
Now,
here.
it's a pleasure to have you here. Now, I myself have been at one point an Oregon Medical Group a patient, as have some people in my newsroom. We woke up yesterday with an email talking about OB-GYN care, the center at Oregon Medical Group closing. But you at Women's Care have an exciting announcement to kind of go with that. What new has come into you folks over at Women's Care?
Well, we're very excited that we've been able to retain three doctors from the Oregon Medical Group who will join us here at Women's Care starting in November. So Dr. Katria Mertz, Dr. Richard Lee, and Dr. Grace Grogman have signed on as Women's Care partners and will continue to see patients and help Women's Care meet this need in the community with these changes at Oregon Medical Group.
What have patients experienced and what can they expect to experience at Women's Care when they're coming and seeking treatment in your facility?
Well, we're really excited that we think that this is going to be a very smooth transition. We've had really good partnership, I think, with Oregon Medical Group in trying to make the patient transition as smooth as possible. So there's been really good cooperation so far in getting medical records transfer and that kind of thing. We will be beginning to see those patients starting November 1st, and patients will be able to contact Women's Care for appointments and so forth starting in the last week of July. So we'll have templates built and books open for November starting the end of July. So we're excited. These are great doctors, and we have collaborated and worked with them as colleagues over the years, and we're excited to have them joining our team.
Yeah, it's exciting news, that important provider retention we'll talk about in just a second. But first, on that idea of the transfer of patients, transfer of records, transfer of care, are you expecting a smooth transition? Say someone watching this at home is an expecting mother, due date late October, and you're thinking, oh, that's right in the middle of all of my, kind of the heaviest business that I'm about to go under. Are you expecting smooth transitions for all these patients as they come over to your facility?
We really are. We have a wonderful team, and we are working on our partnerships with our hospital also to make that transition as smooth as possible. So I really think that, and from a patient care standpoint, our team is really hard at work to ensure that that is smooth come the fall.
I'd say, yeah, especially during those vital times, man, the last trimester. You don't want anything unpredictable, I'd say, during
No.
that time. So, and
Yeah.
I'm sure you can understand. Now, about that idea of care, provider retention. Basically, since the pandemic, I feel like there's been a focus. A lot of providers and nurses, healthcare workers were moved into retirement, changed careers. A lot of things shifted during that, and it feels like chasing the tail a little bit as far as keeping enough providers in places like Eugene. How does it feel for you to, one, be able to join us today to talk about, hey, look, we did that thing that has been so challenging? First off, we'll start there. How exciting is that?
I think it is exciting. I think that your point about the pandemic is a good one. That was such a dramatic time, and it really was a catalyst for moving things along that were happening anyway, right? So demographic shifting, employer and employee relationships, just generational expectations about what the meaning of work and patient expectations about what it means to have good health care are all shifting and changing with the generations, and the pandemic really catalyzed a lot of that. So I think we are seeing shifts. It is harder to recruit here to Eugene Springfield than it has ever been, even though our community continues to grow. And we're just a little bit of an odd size of a community to recruit physicians to for some reason. You know, we're not a small town, so people who want to do a lot of rural work aren't drawn here. And we're not a huge academic medical center. So people who want to, really delve in on the research side and the academic side, we're not a good fit for that either. So we really have to find, the unique physician that is interested in private practice, running a practice, caring for community, having, great, good community to care for with a lot of diversity. But we need people who love the outdoors and appreciate the wonderful things that Eugene Springfield has to offer. But it's a unique subset, I think, of people coming out of training.
Sure. And you believe that the 3 providers you're bringing, you've worked with at least nearby them for a while, they fall into that category of people that obviously want to stay here?
They have deep roots in the community, and so do we, so that is a win-win for all of us. And we expect, all 3 of them to have good long careers with us. So we're excited about that.
Just a few more questions for you, again, about such an exciting announcement. We're talking with Dr. Catherine York from the Women's Care about 3 providers, OB-GYN providers, staying here in Eugene, shifting facilities, though. And about that shift, we talked about how you're expecting smooth transitions. Is there anything patients should be aware of? Should they be calling the facility to get themselves set up? Should they, either prospective or existing patients, any heads up about maybe differences between Oregon Medical Group and Women's Care, things like that?
Well, I think there probably are some differences, and I think it should be very smooth in terms of a patient experience, fortunately, because we have such a good collaboration with Oregon Medical Group at this point. But yeah, come August, we'll be ready to get those appointments made and make those transitions pretty smoothly, I think. I mean, patients will be seen in October at Oregon Medical Group and November at Women's Care. And the office is just across the street. So should be pretty easy.
Yeah, I do love that. They can, oh, doc, where are you going to go? Oh, right there. Just right down the road. You'll be fine.
Exactly.
And glad to hear that there are plans in place to make this transition as smooth as possible, because like we said earlier, no one wants to throw the wrench in the plans of a pregnant person in their 3rd trimester. So
exactly. I think it's as smooth as it could be, fortunately, because we have such a good collaboration.
Well, that's fabulous. I think those are all the questions I had prepared for you, doctor. Is there anything else that I missed you'd like to expound upon or add?
I don't know. I think we've really hit the high points. I think we're really, excited that we're going to be able to have a pretty smooth transition with this change. And we're excited to keep providing great care for the women and their families here in Lane County.
Well, thank you for doing what you do. It takes people being here doing that sort of work. We talk about how important the retention is. That goes for you as well. So, doctor, thank you so much for coming around and chatting with us this morning and sharing this good news.
You're welcome. Thanks so much, Zach.